With almost $20 billion spent on AI in healthcare in 2023, what are the new innovations coming now, and what are good career options going forward in healthcare? So thanks to the Mayo Clinic, which is one of the foremost healthcare institutions in the world, for this information. So my viewers know that AI is already being used extensively for radiology, i.e. reading X-rays, MRIs, CAT scans, etc. But at this point, reading these still needs human supervision. But what Mayo Clinic says is that the AI can complete time-consuming or mundane work, which is aggregating information from multiple scans for a single patient, for example. So clearly, the radiology sector is one area where innovation continues for using AI in the healthcare setting. Another example that Mayo Clinic has identified as an innovation is in risk assessment. So they talk about how certain people have a heart issue called left ventricular dysfunction that's hard to identify. But what they found is using an AI to read those scans can diagnose this condition better than humans can, but again needs human supervision, but an improvement in identifying risk for certain types of heart disease. The next area that Mayo Clinic talks about is patient management, and what they describe is actually a really cool use of AI, in the sense that for people who are on multiple medications, they are developing AIs that can manage this medication schedule for people, meaning remind them, okay, take this thing now, and then an hour later, take the next thing, or 2 hours later, whatever the time interval is. So people who are on many medications at once, it's very difficult for them to track making sure that they took it and took it at the right time right now. And it's easy to make a mistake and forget doses and skip and all that. But a personal AI medication assistant fixes all that according to the Mayo Clinic. So that's a great innovation in using AI in healthcare. Then in terms of improving patient care, they talk about how AI is already better than humans at certain tasks, right? One of the things that they're using AI for now at the AI Clinic is to predict who will survive certain types of cancer. And it turns out that their algorithm that they've developed to do this is way better at predicting patient outcomes following a cancer diagnosis than human beings are. Next, they mention as an innovation in healthcare that doctors and nurses obviously have to have continuing education all the time. And they're using AI to make this educational updates to keep track of current breakthroughs much more automated and targeted to the specialty of the physician or nurse, which makes it much faster and easier to absorb the right information for them to stay at the cutting edge on training. And then finally, in terms of innovation, they say, of course, all these uses of AI in healthcare need to be monitored by human beings still, because they can still make mistakes, but that it has improved both accuracy and efficiency in healthcare, which they believe will lower cost over time. So what about from the career perspective? Well, as I've mentioned many times on this channel, hands-on work will continue. So certain aspects of what doctors and nurses do will be automated, but the hands-on care aspects will not be, and will continue to require human beings to do that part of the work, and will actually give doctors and nurses more time to do that direct patient interaction work, which is a good thing. But also, they mentioned that there's other areas where there are critical staffing shortages right now, where they really need people to go into healthcare. And one of them is physical therapy, because there's many different kinds of physical therapy, and some of them are very very specialized, and you have to do a specific program to do that kind of physical therapy. And there's shortages all over the country in some of these specialties. So there's really great opportunity still in nursing at all levels, and physical therapy, and assisting patients with exercise and movement and stuff, because they try to get people quickly out of the hospital now. And then, as I've mentioned before, also home healthcare is a greatly increasing need due to the aging of the U.S. population, just like what's happened in other countries like Italy and Japan. So there are still many, many career opportunities open and available in healthcare that are decently paid, some of them highly paid, and will provide long-time career stability in the age of AI. So again, thanks to Mayo Clinic for all this. If you like this video, please like, subscribe, and share. Also, please support us on Patreon or buy me a coffee. Your financial support can really help the channel keep growing and reaching more and more people, because our goal here at the AI Guide is to help you navigate the uncertainties surrounding AI automation and your career, and to help catapult your career and help you thrive in the AI age. So thanks so much for tuning in. We'll see you next time. Take care. Bye.